The Mental Health Commission of Canada logo appears. The video begins with the main character standing alone in an empty space, looking confused.
Everyone should have access to quality mental health care, no matter where they live or what circumstances they're in. But where do people turn?
They proceed through a large door, revealing even more doors with signs that say, Culturally Adapted Cognitive Behavior Therapy, Healing Lodge, and Community Health Center.
Mental health affects everyone, including healthcare workers.
As the main character tries to figure out where to go, a healthcare worker in blue scrubs walks past other doors.
But finding the right support when you need it, in a way that you can access it, is harder than it looks.
The main character walks through another door, entering a corridor lined with doors. The signs above the doors read, Psychologist, Psychiatrist, Primary Care Providers, Office closed, short of staff.
For many people, seeking help means knocking on a lot of doors, at a time when their resources are already depleted.
The signs above the doors read, Crisis Line, Psychotherapist, Counseling Therapist. They enter a room with two park benches facing each other, surrounded by more doors. The healthcare worker is seated on one bench, acknowledging the main character.
Finding no clear pathway, meeting one barrier after another, they often give up before getting the mental health care they need.
Feeling defeated, our main character sits down and looks around. The door signs read, Transportation not available, Interpreters not available, Health insurance required, Referral required, Open 9 a.m. to 5 p.m. only, Not accepting new patients, Emergency closed. A light emerges from a large double door in the distance. As the double doors open, they both look toward it. The main character rises and walks through the open doors with a sign labeled, Quality Mental Health Care Framework.
The Quality Mental Health Care Framework works to support the entire healthcare system and improve the mental health of service users and providers. Through its collaborative approach, it can also improve how people access mental health care and increase their quality of care in the hospital and community through counseling, peer support, medications, and more.
The door leads them to a warm and inviting space with some furniture and a big colorful wheel imprinted on the floor. The wheel is divided into 10 equal pie-like shapes, called dimensions of the framework, and labeled as work-life environment, integrated, people-centered, safe, recovery-oriented, stigma-free and inclusive, trauma-informed, appropriate, accessible, continuous learning, and improvement. A man and a woman are talking to each other near 6 doors labeled with a smaller version of the wheel. The woman greets the main character, and the man greets the healthcare worker as she enters the room. Our main character, who seems intrigued to be there, waves.
The framework offers a holistic approach to improving the quality of mental health care across the system. It provides clear, measurable dimensions that give service users the knowledge to identify quality care and the confidence to advocate for it when certain areas fall short.
The woman walks over to welcome and offer guidance to the main character, who stands in the middle of the framework wheel. Similarly, the man walks over to the healthcare worker and offers his help. The main character receives some guidance from the women in the framework room and optimistically walks toward one of the doors labeled with the framework wheel.
By adopting the framework, healthcare organizations are sending a clear message to people who need services, including providers, that mental health matters for us all.
A diverse group of people line up and walk through the Quality Mental Health Care Framework room.
Everyone should be able to open the door to quality mental health care.
To learn more, go to www.mentalhealthcommission.ca/QMHCN. The Mental Health Commission of Canada logo appears. Follow us on social media. The views represented herein solely represent the views of the Mental Health Commission of Canada. Production of this video is made possible through a financial contribution from Health Canada.